There we go. Good afternoon, everyone. Assistant Secretary Greenlee, and thank you, Edwin, for the introduction. Thank you, MT, for the accommodation to let me go ahead of you, members of the forum. And I'm very pleased to be part of this singularly important event that has taken some time to go forward, and I'm glad it's happening. I think it's very important for the whole elder justice movement. Now, talking history and being a last speaker don't go together, so I'm not going to spend a lot of time on history. You've probably heard a lot about history, but there is a developing history about elder abuse that has gone back since the 1970s, and I'm living proof because I was there in the 70s on the House Aging Committee when we began this work. But really, we can fast forward to 2002, 2003, when the introduction of the Elder Justice Act and the founding of our Elder Justice Coalition, of which a number of my colleagues are in the room today. This bill grew out of hearings and related work of the Senate Aging Committee, but it was motivated by two basic things. Less than 2% of federal dollars were being spent on elder abuse, of abuse prevention dollars, and no single person in the entire federal government was working on elder abuse. Subject of numerous hearings in the Senate. And in fact, in these day and age, it's pretty remarkable. This bill actually passed the Senate Finance Committee, the most complicated committee in the Senate, on 3 different occasions unanimously. But then finally, in 2010, it became an amendment to the Affordable Care Act and is now, as Edwin called it, a landmark law. And since that time, our process has involved securing funding for the 13 different pots of money in the bill, implementing the law, and working to pass parts of the original bill which were not able to be included, including the Elder Abuse Victims Act. Briefly, the Elder Justice Act features an authorization of $777 million over 4 years. It establishes an Elder Justice Coordinating Council, which does just what it's supposed to make recommendations on how to have a more coordinated federal response to the issue of elder abuse, neglect, and exploitation. And again, thanks to the leadership of Kathy Greenlee, the Coordinating Council was convened in 2012. It establishes a 27-member advisory board on elder abuse and neglect to work in concert with the Coordinating Council. It's not yet named, but we continue to be optimistic. The main feature of the bill, dedicated funding for the Adult Protective Services, something way long overdue. In 13 states, you have no funds going to Adult Protective Services, which is unconscionable in this day and age, and to provide additional money for state demonstration grants to do best practices in APS, to provide needed money for the Long-Term Care Ombudsman Program, to help them get better training and do a better job in their very important work in nursing homes. Authorizing funding to enhance the quality of long-term care staffing, both the retention and the recruitment of qualified staff. Authorizing $15 million over 4 years to do the one thing that you probably have heard over and over again in this forum, the need to improve our data collection processes. 2012 was a year of progress. We saw World Elder Abuse Awareness Day reach the highest levels by having an event held at the White House with a proclamation from the President and the awarding of new grants from ACL and AOA to, again, test best practices going forward on elder abuse prevention, and money going to tribal organizations as well. These were funds that were provided through the Affordable Care Act Prevention Fund. Prevention and Public Health Fund is its real name. But it's really, this is a classic example of good advocacy. Now, Kathy Greenlee and I share a love of basketball, and a good basketball team has good inside players who can go to that basket and score. Kathy did a good inside job of getting money for the Affordable Care Act Prevention Fund for Adult Protective Services and for elder abuse. In 2012, the Elder Justice Coordinating Council was convened. Very significant meeting, very important meeting. I was pleased to testify at it. A lot of federal agencies sitting here for the first time talking to one another about what they were doing in this area. The President's budget back last year included funding for the Elder Justice Act for the 2nd year in a row. The Senate Help Committee put money in their bill, but unfortunately the process wasn't completed. The excellent ongoing work of the Office of Older Americans and the Consumer Financial Protection Bureau, led by Skip Humphrey, the former Attorney General from Minnesota. Department of Justice's ongoing work with the Roadmap Project. And of course, in my judgment, the re-election of President Obama ensures the continuation of work on the Elder Justice Act as it's a priority in HHS and the CFPB. A range of bills introduced in the past Congress shows you the level of interest on a bipartisan basis to this topic. The first bill in particular, which would enhance the ability to prosecute cases of elder abuse, dedicated funding for special units to prosecute cases. Of course, the Older Americans Act is the forerunner of legislation dealing with elder abuse prevention, and it's up for reauthorization again. Several important reports came out and journal articles. The second one in particular, Dr. Dong, I know, contributed a lot to that journal. And that third one was important because of that dollar figure. You know, you can talk about this issue all the time, but you need a dollar figure to show what the human impact of elder financial abuse is. And this study accomplished that. Already in 2013, we see some very important accomplishments in this field. The enactment of the Violence Against Women Reauthorization gives all of us hope that bipartisanship can show up in Washington every once in a while. The reintroduction of the Elder Abuse Victims Act, a critical bill, the one on the prosecution side, Congressman Peter King of New York and 6 co-sponsors on a bipartisan basis. The very first hearing of the Senate Aging Committee with a new chairman, Senator Nelson from Florida, was on elder abuse back in April. The Senate budget resolution passed with an amendment to support the Older Americans Act, which includes Title VII elder abuse activities. To be done. This is an advocacy session, so you know there's going to be a to be done in this. Funding the Elder Justice Act. Okay? $777 million authorized. We need to start seeing more money go into the streets, boots on the ground going forward. Implement the rest of the Elder Justice Act. We need to get that advisory council created. We need to have a designated home for adult protective services in HHS. We need to invest in data collection that's meaningful. We need to enforce the existing CMS guidelines on reporting crimes in nursing homes. And we need more states to apply for grants for criminal background checks, which was related to the Elder Justice Act. I wish I could go through the story of how many people they turned away from employment and what they found when they did background checks in 7 states. It was remarkable. We need to reintroduce the bills from 2012 in the new Congress. And we need to pass the Older Americans Act. This used to be a no-brainer in our world. Bipartisan, non-controversial. It's not just because of the elder abuse provisions of the Older Americans Act. The National Family Caregiver Support Program. We've talked about the relationship of caregiving and abuse prevention. This law is critical to that. This horrible world that we're all living with, called sequestration. These cuts are affecting elder abuse detection and prevention programs around the country. The Social Services Block Grant. Cuts to Title VII, the Older Americans Act, are in double digits in some states. So now we have even less money to some degree than we had from an inadequate amount when we started this process 10 years ago. So if you want to start with an advocacy message, not sequestration could be stopped, it should be stopped, starting in fiscal year 2014. Otherwise, it could go for another 10 years. The budget proposals in elder justice, the House bill, the House budget would repeal the Affordable Care Act, which would repeal the Elder Justice Act. The Senate amended their budget to support the Older Americans Act, which could lead to more money for abuse prevention activities. And the President, in his budget just released, allocated $8 million, or requested $8 million for adult protective services and continued funding for the Title VII programs. And Kathy, I know we'll talk about this, but this is remarkable because this is important, dedicated Elder Justice Act money. Broken down in that category, in that area. And the Title VII money is ongoing money for programs that have been around for a number of years. They're all important. They're all related. But they all need money. And then we were obviously pleased with last year's release of $6 million from the Public Prevention and Public Health Fund for elder justice, but we just learned a couple days ago that HHS just announced they'll release another $2 million for elder justice this year, and we hope it can be dedicated to data collection activities, which again is a critical investment. How has the progress been made over these years? It's a long story, more than I have time to explain, but I will tell you something. This issue has always been bipartisan, always been modest in scope, and it's always been driven by developing advocacy at the national, state, and local level. Our coalition is a perfect example. Those 5 groups you see there, that's how we started, with 5 groups, and now we have 3,000 members. This issue is real. Media coverage has helped on our efforts, especially on the celebrated cases that we know about. But going forward, the advocacy must be more aggressive and more state-of-the-art. We're working with Ageless Alliance out of California to increase the visibility of elder justice on social media. We got to get there. That's very important. We have to do better advocacy in times of sequestration and deficit reduction. And it has to be advocacy which stresses the preventative aspect of elder justice. We need to invest in programs that will save money in Medicare and Medicaid and document those dollar savings. That's the message we need to get out. We cannot stop what is not reported, so we have to invest in better detection, more reporting, and more resources to the entities where elder abuse is reported. You know, it's called elder abuse, but as you've heard in this forum, it's a growing women's and boomers issue. The average victim is an older woman living alone, and nearly half of women 75 and over in this country now live alone. Boomers control 70% of disposable income, and now the first wave boomers are 67 years of age. Advocacy on this topic or any topic is about localizing and humanizing this issue and realizing that we're 40 years behind child abuse advocacy. The Elder Justice Act, sadly, and it's hard for some of us to believe, it actually expires in 2014. So this year is the pivotal year to show its value. We need to finish the work in Congress and in the administration. We need to communicate, advocate, and tell the story on behalf of one fundamental issue, the victim. Because the victim of elder abuse, neglect, and exploitation is never the same, and it's our job to prevent elder abuse. Thank you.